Dear students, welcome back. In the previous session, we have discussed about the gluteal region part 1. In that, we have discussed about superficial fascia, deep fascia, and the landmarks of the gluteal region. Now, in this session, we are going to discuss about gluteal region muscles. So, in this session, we are going to mainly discuss about the very big muscle that is called as gluteus maximus. Okay, so this gluteus maximus is a thick quadrangular muscle which is greatly responsible for the gluteal prominence. Okay, normally this gluteal region is having 10 muscles. So out of these, this gluteus maximus muscle is present superficially and which is greatly responsible for the gluteal prominence. So these are the underlying muscles on this side. The muscles are present below the gluteus maximus muscles. First, now we are going to discuss about the gluteus maximus muscle. So in this we are going to discuss the origin, insertion, okay, and the structures which are deep to the gluteus maximus, its nerve supply and its action. Okay, yes. Now, so as I have mentioned that this is a quadrangular muscle. It takes origin from posterior gluteal line. It takes origin from posterior gluteal line. Here you can find the posterior gluteal line on the outer or gluteal surface of the ilium, and also the area above the posterior gluteal line. Outer sloping surface of the dorsal 1/3 of the iliac crest. Dorsal 1/3 of the iliac crest. And also here you can find the sacrotuberous ligament. Okay, some of the fibers which are originating from the sacrotuberous ligament. Okay, and also the fascia covering the muscle, and it also takes origin from the dorsal aspect of the lower, okay, dorsal aspect of the lower and lateral part of the sacrum and coccyx, lower and lateral part of the sacrum and sides of the coccyx. So these are the origins of gluteus maximus muscle. So if you see the course and insertion from all these areas, so this muscle is getting originating and the fibers are directed downwards and laterally. The fibers are directed and downwards laterally, and which are inserted as upper half and superficial part of the lower half are inserted into the iliotibial tract. That means this muscle is having a superficial part and deep part. So the upper half and the superficial part of the lower half. Okay, upper half and the superficial part of the lower half are inserted into the iliotibial tract. Now the deep part of the lower half is inserted into the gluteal tuberosity. The lower half, which is the deep part, is inserted into the gluteal tuberosity, that is which is nearer to the trochanter. Okay, yes, trochanter of the femur. The nerve supply is mainly by inferior gluteal nerve. It is supplied by inferior gluteal nerve. If you see the action, It is the chief extensor of the hip joint and it helps in the lateral rotation of the thigh. It helps in the lateral rotation as well as the extension of the thigh. And it steadies the tibia on the lower end of the femur to maintain the erect posture while standing. So these are the actions of the Gluteus maximus muscle. What is the main action? It is the chief extensor of the hip joint. It helps in the lateral rotation of the thigh. Okay, and it also studies the tibia on the lower end of the femur to maintain the erect posture while standing. Now we are going to discuss about the structures deep to the gluteus maximus. What are the structures which are related? That means which are present below the gluteus maximus. In this we can see bony structures, bursa, ligaments, muscles, nerves, as well as some of the blood vessels which are present below this gluteus maximus muscle. If you see the bony structures in this pic only, we can see the bony structures. One is the greater trochanter. We can see this is the greater trochanter, and also we can see the ischial tuberosity. Okay, and also we can find the ischial spine also. Okay, so these are the three structures, bony structures, which are present below this gluteus maximus muscle. And if you can see the bursae, one is the trochanteric bursae of the gluteus maximus on the greater trochanter of the femur, and also you can find the ischial bursa of the gluteus maximus on the lower and medial part of the ischial tuberosity. And another bursae is called as gluteofemoral bursae between gluteus maximus and tendon of vastus lateralis muscle. So these are the three bursae we can find. Okay, so now, and also here we can see the ligament which is related, which is present behind the muscle is already, the origin is also taking place from the sacrotuberous ligament. This is the main ligament which is which connects from the lower and lateral part of the sacrum to the ischial tuberosity. Okay, and also sacrospinous ligament which is stretching between the lower and lateral part of the sacrum. Okay, lower and lateral part of the sacrum and the ischial spine, So these are the two ligaments which lies deep to this muscle. One is the sacrotuberous ligament, from where from that ligament also this muscle is getting originating, and it is extending from the lower and lateral part of the sacrum to the ischial tuberosity. The name itself indicating that from sacrum to tuberous, that is ischial tuberosity, called as sacrotuberous ligament. Another one is the sacrospinous ligament which is stretching from the lower and lateral part of the sacrum to the ischial spine. Okay, so this sacrotuberous ligament which lies not sacrotuberous ligament, sacrospinous ligament lies deep to the sacrotuberous ligament, and it is considered as degenerated posterior part of the coccygeus muscle. Okay, so these are the structures. One is the bony structure, bursae, and the ligaments which are present deep to the gluteus maximus. Now we will see what are the muscles which are present under this gluteus maximus muscle. Okay, yes. So here we can find the muscles. Okay. So this one is the Gluteus Maximus muscle. You can find here. So this is the Gluteus Maximus muscle. And below this Gluteus Maximus, what are the muscles are related? We can see from above downwards. We can see how the muscles are present from above downwards. That means below the Gluteus Maximus we can find one muscle, and then below that muscle you can find another muscle, like that. Yes. So the lower part of the Gluteus medius muscle. So below this, from above downwards, below the Gluteus Maximus, the first one is Gluteus medius, and then deep to the Gluteus medius we can find Gluteus minimus muscle, and then we can find the piriformis muscle. So here in this pic we can see. So this is the piriformis muscle, and then we can find the gemellus. So superior gemellus. Below this one we can find the tendon of obturator internus, and then we can find inferior gemellus. After that we can find the quadratus femoris muscle, and also we can find adductor magnus and the origin of hamstrings. So these are the muscles which are present below the Gluteus medius, Gluteus Maximus muscle. Okay. If you can see some of the nerves, so the main nerve is the sciatic nerve. So the sciatic nerve is the main nerve which is related to, which is present below the Gluteus Maximus, and also we can find nerve to quadratus femoris. Okay, so here you can find the nerve to quadratus femoris. And you can find the nerve called as posterior cutaneous nerve of thigh. So you can find the posterior cutaneous nerve of thigh, and nerve to obturator internus, and pudendal nerve, and the internal along with pudendal artery you can find. Okay, and also you can find inferior gluteal nerve. Here you can find some of the arteries, that is superior gluteal artery you can find, and inferior gluteal artery you can find below this thing. So these are the main blood vessels you can find, vessels as well as nerves. What are the main nerves? One is the sciatic nerve, nerve to quadratus femoris, and posterior cutaneous nerve of thigh. Okay, and then inferior gluteal nerve, okay, and then pudendal nerve and nerve to obturator internus. So nerve to obturator internus. So these are the main nerves which are related, and here we can also see the superior gluteal nerve. Okay, and if you see the blood vessels, superior gluteal artery, inferior gluteal artery, and internal pudendal vessels. So these are the nerves as well as vessels. And below this we can find the anastomosis around the hip joint also, which is related to this structures which are present under the Gluteus Maximus muscle. Okay, so in the next session we are going to discuss about the remaining muscles: origin, insertion, nerve supply and action. Thank you.